I'm Kathryn, and I'm in long-term recovery with over 15 years of sobriety. I met Susan when I toured a jail to learn about addiction in jails. She was about to begin her prison term. What Susan and I have in common is our addiction. The disease of addiction is destroying lives, families, futures across every social and economic group in our country. This year alone, over 60,000 people will die of a drug overdose in the United States. Yes, addiction is a disease. Scientists, physicians, and the US Surgeon General agree that addiction is a disease. It's a chronic brain disease that affects behavior. Susan and I are like more than 20 million other people across our great nation who have the disease of drug or alcohol addiction. Back in the 1930s, scientists began studying addictive behavior because people addicted to drugs and alcohol were thought to be morally flawed. Those views shaped society's response to addiction, treating it as a moral failure rather than a health problem, which led to an emphasis on punishment rather than prevention and treatment. Alcohol addiction was declared a disease by the American Medical Association way back in 1954. Welcome to 2017, where addiction is still viewed by many as a lack of willpower or a character flaw, and is amazingly approached with punishment rather than treatment in many communities. This punishment approach brings with it a powerful shame and stigma that influences our laws, our services, research, care, and support for people with the disease of addiction. 3 words have deprived addicts of medical treatment, empathy, and compassion for decades, or more like centuries: shame, stigma, and discrimination. The shame and stigma of being an alcoholic influenced my own decision to not seek treatment and to keep my disease hidden. And I am not alone. Sadly, only 1 in 10 people who need treatment for addiction actually seek treatment. My drinking started in high school. I knew as a teenager I didn't drink like others. I experienced my first blackout while in high school. I struggled with alcohol-related issues and episodes over the next 25 years. I chose to live and work in cultures with excessive drinking. I had no desire to attend events that didn't have alcohol, and I couldn't imagine my life without alcohol. I had a fairly successful life, despite my constant struggle with my addiction and its impact on my career, my family, and my relationships. But I could never reach my full potential with my addiction holding me back. There came a time when I knew I needed to stop drinking, but addiction is a powerful disease, and it kept me drinking for many years. I could achieve any goal I set for myself, but I could not stop drinking. Even though I experienced many defeating, demoralizing, and baffling drunk episodes. I thought I was insane. I'd stop drinking for 3 months and then start again. I'd stop for a year and then start drinking again. And this happened for over a period of 8 years. I am so grateful that my higher power kept asking me to pull on my boots and try again. I finally became completely willing to do whatever it would take to get sober. And when I became completely willing, that's when the miracle happened for me. And I started staying sober. I found a program that's built on a foundation of gratitude, helping others, and a higher power. And it changed my life. I'll forever be grateful to this program and its people for embracing me and helping me stay sober. And it's my sobriety and my role as First Lady of North Dakota that has allowed me to shed light on this issue and visit firsthand those suffering. And this is what I've learned. The powerful disease of addiction comes in many forms. The disease of drug addiction has become a monster of gargantuan size with the opioid crisis. These powerful drugs turn normal people into thieving, conniving shells of who they once were, and likely who they'll never, ever be again. The brain chemistry of those addicted to opioids can be forever altered. They may crave the drug for the rest of their lives. Opioid addiction starts for many when they are teenagers or adults with a doctor's or a dentist's prescription for pain medicine. My niece was an all-state goalie in high school. She injured her knee while playing hockey and was given pain medicine. Unbeknownst to me and her family, she became addicted to opioids. And she's 23 now, and I recently helped her find treatment for her addiction. Surprisingly, 1 in 4 people addicted to opioids got their first pill from a doctor, a friend, or a relative. 91 people die every day in the US from an opioid overdose. I met the parents of a boy who died of an opioid overdose in his car in a high school parking lot. They were devastated by their son's needless death. However, there was no outpouring of community support like there would be for a teenager who died of cancer or in a car accident. Shame and stigma keep people away. My friend Sheila knows the feeling of shame because her daughter has been addicted to heroin since she was 16. Heroin is a cheaper street version of an opioid drug. Sheila told me recently that she called her daughter's probation officer regularly, hoping she would get arrested and sent to prison. Sheila knew it was the only way to save her daughter's life. Sheila's daughter is now in prison. Sheila knew that the only opportunity that her daughter would have for recovery was through medication-assisted treatment, but she was not able to get that treatment. For many addicted to opioids or heroin, their best hope for recovery and to live a normal life is medication-assisted treatment. Medications may be taken daily for the rest of their lives to be able to live a normal life. Now, I realize that the use of medication to treat addiction and help people reduce the cravings is controversial. But I ask you to consider this. This is similar to the disease of diabetes, where insulin may need to be taken lifelong to keep diabetes in check, to lead a healthy, normal life. Addiction to methamphetamine is also destroying communities and families. I know of a Native American tribal chairwoman who cared for her grandchild born addicted to meth. The baby's little hands were covered with tiny gloves to prevent her from scratching herself or pulling her hair out while going through meth withdrawal. Babies and children are the innocent victims of the devastation caused in our communities by untreated addiction. Many people addicted to drugs or alcohol end up in jail or prison because of addiction-related crimes. 65% of people incarcerated in the US have an addiction. And most of them need treatment and not incarceration. During the past 30 years, it was thought that more punishment meant less addiction. Addicts who are convicted of nonviolent, possession-related crimes carry the extra burden and stigma of being a felon when they are released from prison. Felons can't find jobs, they can't find safe homes, and in some states, felons can't live together in the same building. This felony discrimination towards the disease of addiction perpetuates the cycle of addiction. Addiction is and should be viewed as a lifelong chronic disease like diabetes or heart disease. 30 million children and adults in the US have diabetes. In 2016, $34 million was invested in research to find a cure. The mission of the American Diabetes Association is to prevent and cure diabetes and to improve the lives of all people affected by diabetes. Think about this. What if addiction could be viewed in our communities in the same way as diabetes? And what if there was an American Addiction Association with this mission: to prevent and cure addiction, to love, respect, and care for all people in our communities affected by addiction. Addiction needs to be treated and embraced like any other chronic, progressively fatal illness or disease before real changes can be made in our communities and before the shame and stigma can be eliminated. This is my mission each and every day as an advocate and a recovering alcoholic. I ask you to become advocates and bring your advocacy to the streets. If you have an addiction, start talking about it. If you're the caregiver of an addict, have a child or loved one that has an addiction, share this information with a person next to you today. If you know someone who is suffering from alcohol, meth, or opioid or other addictions, talk with them about it. Hug them every chance you get, because they may not be there tomorrow. Talking will remove the shame and the stigma. We can work together in every community and in every home to help save lives, help those that have given up hope, and help our communities start dreaming of the future again. We are a nation in crisis. Now, I stand here today asking all of you to help me lift the shame and stigma of addiction. I'll end with a saying from the Native American Ojibwe. You cannot destroy one who has dreamed a dream like mine. I'm dreaming of a bright future for our nation, one where the American Addiction Association has found a cure for addiction, and where there is love, support, and kindness for people, families, and communities suffering from the disease of addiction. Thank you.